I was talking about, a conversation when it comes to these cold temps. Okay, we also know around this time, because it gets cold in the weather, it's also really big for flu season as well. Out of North Carolina, their Health and Human Services Department right now reporting a rise in flu activity and flu related deaths. 3 deaths reported this week, bringing the total to 9, which is higher than this time last year. Last year, the state reported just over 540 flu related deaths, which was the most since 2009. Okay, so there is a strain right now that officials are saying in North Carolina. It's called subclade K. It's pretty dominant at the moment. It differs slightly from this year's vaccine, but early data is showing, according to these officials, the shots does still offer protection, but they are seeing some flu-related deaths and illnesses kind of on an uptick there in North Carolina. And with that in mind, I did speak with a doctor with CHKD about not only the flu, but other respiratory illnesses, as we are right now kicking off flu season, okay? And so for the next few minutes, we'll listen to a conversation between me and Dr. Laura Sass with the Children's Hospital, the King's Daughters, here in Hampton Roads, on what you can do to best prepare and protect yourself from respiratory illness. We referenced flu season. When does it officially start, and how long does it go?
Well, it usually starts around now. It changes as flu seasons are cyclical. Sometimes we have a very mild season, and then the next year we get hit hard. That's what we're predicting for this year based on what is happening in Australia and the Southern Hemisphere. Remember, it's a winter thing. So as the weather gets cooler, and people spend more times indoors, and there's more transmission from person to person for those respiratory viruses like influenza. We know that in Australia, they had a lot of flu. So our prediction is that we usually mimic what happens. It is starting now, but we haven't been hit really hard and heavy yet. But we pay attention.
We talk about the best practices all the time on air to kind of protect yourself. And a part of that is the vaccine, the flu vaccine. When's the best time to get it?
Now is perfect. We actually already finished our influenza campaign here at the hospital. We have everyone vaccinated by October. The other health systems do similar things to make sure that everyone is healthy. Remember that vaccine does not prevent you from getting the flu. It prevents you from getting the serious complications of the flu that would give you higher risks, such as getting hospitalized or having secondary infections like pneumonia. Vaccination does not prevent infection, but prevents the serious complications of those infections. That's how vaccines work. And that is actually hold true for both flu and COVID and all of our other vaccine programs.
And people always want to know how effective this year's flu vaccine is. Do we have an answer for that?
It's a little early to tell because we really haven't hit our flu season. We generally estimate it's about anywhere from 50 to 70% effective, which when people hear that, they're horrified. Like, why wouldn't it be more effective? Especially when we have vaccines like measles that are 95% effective. And part of that is we actually change the flu shot every year. Well, not we personally, we as a global community. And it's based on what circulated the year before and how well that guess and match happened. The good thing about it is a little bit of protection is still helps you from not getting those serious complications of influenza. And you may only have a mild cold and maybe not even a fever compared if you're unvaccinated, where you're at much greater risk to get the fevers, the body aches, and just generally feeling bad. People who've actually had influenza, remember it because you don't feel good. It is not the sniffles.
And people often say, too, you're talking about some of the symptoms of the flu where they'll get a flu vaccine or a vaccination and they'll feel some type of side effects from it. Are there any side effects that people should maybe expect if they are to get the vaccine?
Yeah, sometimes you can get a sore spot on your shoulder of where you get it. And sometimes you can feel not quite yourself right after the vaccine. That's your immune system working. That means your body is actually responding to that vaccine and you're having some immune response to the protection. Some people will get a swollen lymph node in that arm where you get that shot. It was much more common with our COVID vaccines than with influenza, but that can happen as well. And those only last a day or so and go away.
About if me or my child has asthma, allergies, any other kind of medical complications? Is the vaccine safe for them? And then also, what are some things that you can possibly do to prevent even further getting sick?
Yeah. Well, yes, the vaccine is actually very safe for them. And in fact, it is very highly recommended for them. Anybody who has an underlying illness or condition that would put them at greater risk to have bad flu needs it. So, asthma. Anybody who has other respiratory, like adults who have COPD, adults with heart disease, our patients whose immune systems may be impacted by cancer. The flu vaccines we have are not live viruses, generally, the ones that you get the shot for. The one that goes up your nose is different. That is live, and certain people shouldn't get that one. But it is there to make sure that you get a little bit of protection. And so we do strongly suggest all those patients get the flu shot. There are no more risk to get flu shot side effects with those. So if you have asthma, there is no, you don't have any increased risk to getting a sore arm or some just generally not feeling well than you would if you didn't have asthma. But if you have asthma and you get the flu, you're much more at high risk for going into the hospital. We know that last year our flu season had a great increase in childhood deaths across the United States. And so the majority of those children were not immunized. And so it's, one would hope that if they had been, when you just look at those numbers overall, that might have prevented some pediatric deaths. And so that's why, especially in children with underlying issues, it's important to get them vaccinated.
At what point, what symptoms should kind of tell a parent, hey, my child needs to stay home from school?
Fever. No, and in fact, there are rules for that for the school systems. As anyone who has a parent who knows when their child gets a fever, you get that phone call and you can't come back. And so fever is a big one. When they don't overall feel well, and parents know their children, they know what their children's normal behavior is. You don't want to send a child to school who's coughing so much that they can't control it, and that's distracting for them in their learning environment, and it's distracting for the other children as well. So those are the big ones. Vomiting. Now, influenza in kids can make people vomit. You generally don't get loose stools or diarrhea with it. People talk about the summer flu. It's not the same thing. But adults generally don't get the same side effects as that, or the same symptoms. They don't really get the vomiting part, but kids can. You shouldn't send a kid to school if they're throwing up.
Are all of those symptoms the same? If I were to ask you, when should they go to a doctor?
A little bit. So generally, if someone's still sick 2 or 3 days later, or they're not acting correctly, they're not thinking, like you talk to them and you just know that there's something not quite right. That is the first thing to do is call your doctor, call your pediatrician's office, because they may know that we are seeing an increase in flu, or they could have one of the other respiratory viruses as well and give you some good guidance. As always, if any child has trouble breathing, is not recognizing their parents are not acting like they know what's going on, those you go to the emergency room. Like it's never wrong if you're worried to call the doctor or go find and seek medical care, because we don't want those children to be sick. The other thing to look for is if a child has the flu, is sick for a few days, gets better, and then gets sick again, especially with fever, those are the times you need to go to the doctors, because that's a time where we worry about children getting a secondary bacterial pneumonia, either with a staph or strep bacteria, that's actually going to need to be treated differently, and usually with antibiotics. In the beginning, you remember you don't need antibiotic for the flu because it's a virus. It doesn't work. But when you have the flu, it actually changes the way your body reacts to different bacteria and can get you greater at risk for those infections, which is one of the reasons why people die after the flu. It's the flu combined often with another bacteria.
So we're in the house, people are sick, or maybe we know people who are sick. How
Yes.
can we reduce the spread of, something like the flu inside our house if we already know it's infiltrated into the household?
Yes. So we already know a lot of things. I mean, the pandemic was not fun for any of us, but it gave us some really good skills. People then realized hand washing. Hand washing is amazing. Washing your hands after you blow your nose, after you cough, coughing into your elbow instead of into your hand, wearing a mask. Masks help prevent infections. The period of time where we were all isolating for COVID and we were all say 6 feet apart and not socializing, we had virtually no influenza the next year because all of those viruses are transmitted the same way through respiratory coughing and droplets. They land on something, making sure you clean surfaces. With something, you don't need something fancy. Most of your household cleaners are good enough. And really, you need, cleaning off the toys that the kid has in their mouth. And that helps a whole lot. But hand washing is a wonderful thing.
Thank you so much. Is there anything that we haven't hit on when it comes to this topic that you are like, I want to make sure that our viewers and fellow people in the community hear when it comes to the flu or respiratory illness over the next few months?
So one of the big things is vaccines. Vaccines are safe, they're effective. But remembering that, again, immunization does not prevent that infection. It prevents the serious complications of that infection. And I think that is sometimes it gets lost a little bit. Staying away from someone who's sick. So it's hard at the holidays because we want to go to everyone's house and see. But if you are sick or your child is sick, maybe stay home and celebrate the next day or after everyone gets better. No one wants to be that first patient who exposes grandma and has worse outcomes because of that. And so wash your hands, wear your mask, and get your flu shot.
You heard her. Those are the instructions that they are leaving for people as we are in this flu season and other respiratory illnesses. They're wanting to make sure people can be as protected as possible and just prepared as we look at every single year. But we do have some areas that are seeing an uptick already in those flu cases, as I told you prior to that interview in North Carolina, for instance.